Welcome to my channel, Brainies. In today's video, I'm going to talk about the Romberg's test and the tuck test, which is the timed up and go test. About the Romberg's test, the purpose of the Romberg's test is to assess the static balance and determine the contribution of proprioception, vision, and the vestibular input to postural control. The equipment used is there is no specialized equipment as such. It is a firm floor or the flat standing surface. The procedure: patient is asked to stand upright with feet together and the arms held by the side. Observe the sway with eyes open and then ask the patient to close the eyes while maintaining the same posture and observe for 30 seconds. The positive sign indicates that there will be excessive sway or loss of balance with the eyes closed, which indicates the sensory ataxia or the proprioceptive or the vestibular deficit. In case of negative test, the patient will be able to maintain the balance with minimal sway, which is the normal findings. This is a picture depicting the Romberg's test. So the precautions to be followed is always it is better to stand very close to the patient so as to prevent the falling. The clinical interpretation is the loss of balance which happens only when the eyes are closed. It indicates the proprioceptive deficit. That is example in case of dorsal column lesion or in peripheral neuropathy. If there is loss of balance both in case of eyes opened and eyes closed, it indicates the cerebellar ataxia, which is the cerebellar or vestibular dysfunction. The clinical tips is test on both the firm and compliant surfaces so as to increase the sensitivity, and it can be combined with sharp and Romberg tests for higher challenge. The next is the timed up and go test, which is a tuck test. The main purpose of this test is to assess the dynamic balance, mobility, and the fall risk during the functional activities. The equipments used are the standard armchair, and the chair height should be approximately 46 centimeter, stopwatch, and a 3-meter walkway which has been marked very clearly. The procedure is patient is asked to be seated in a chair. On the command given go, the patient stands up, walks up for 3 meters, turns around to 180 degree, walks back and sits down. The timer has been noted down. Record the time in seconds. From the instruction go back to the point when the patient sits again. This is a picture depicting the tuck test. So the clinical use is it evaluates the functional mobility, gait balance, and the rehabilitation progress, and it has been widely used for the screening of the fall risk. Advantages is it's a very simple method, quick to use, requires minimal equipment usage, reliable method, and it reflects the real world mobility. Limitations: it has been influenced by the muscle strength, cognition, and motivation, and not specific to one system. The clinical tips are allow one practice trial at least before the timing starts, and use a consistent chair height and footwear for retesting. And if there's any assistive device which has been used, record that assistive devices. And the interpretation, the scoring are the interpretation for a normal healthy adult. If the time taken is going to be 10 seconds or less, it denotes the normal mobility, which is freely mobile, low risk of falling. And if it is going to be 11 to 12 seconds, it's typical for a healthy older adults. 13 to 40 seconds, it is borderline, which may indicate mild mobility impairments. And if it is more than 13.5 seconds, it indicates increased risk of falling. And more than 20 seconds, it indicates the limited functional mobility. And if it is more than 30 seconds, it requires assistance, that is, there is a high risk of falling. So the normative values based on age group, approximately the time taken would be 8.1 seconds for the patients falling in the age group of 60 to 69 years, and for the age group of 70 to 79 years it is approximately 9.2 seconds, and for the age group of 80 to 99 years it's approximately 11.3 seconds. That's it with my video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.